If you see this in your stool, it could be pancreatic cancer. 7 early signs of pancreatic cancer. Many people are often unaware that they have pancreatic cancer until it has spread to other parts of the body. Pancreatic cancer is one of the most deadly cancers in the world, because it is so difficult to detect early. But there are some early signs that may indicate you have this disease before it becomes life-threatening. In this video, we will talk about the top 7 early signs of pancreatic cancer. If you want to know more, stay tuned till the end. Number 7. Unexplained weight loss. When a person is diagnosed with pancreatic cancer, they usually experience an average weight loss of between 5 and 10%. However, in some cases, the weight loss can be as much as 25%. This weight loss is not intentional and occurs because pancreatic cancer cells divide rapidly and uncontrollably. As a result, they require a lot of energy to survive. They take this energy from the body's fat and muscle tissue, which leads to unintentional weight loss. Also, pancreatic cancer can cause changes in eating habits and taste, which also causes weight loss. 6. Jaundice. Jaundice is a condition where the skin in the whites of the eyes turn yellow. It happens when there is a buildup of bilirubin in the blood. Bilirubin is a yellow substance that is produced when the liver breaks down red blood cells. Normally, bilirubin passes through the bile ducts into the small intestine, where it is eliminated from the body. But if the bile ducts become blocked, bilirubin can build up in the blood and cause jaundice. Pancreatic cancer is one of the most common causes of jaundice. This is because the tumor can put pressure on the common bile duct, which causes bile to back up into the body and cause jaundice. Other symptoms of jaundice include dark urine, pale stools, abdominal pain, and itching. 5. Changes in bowel movements. Another sign of pancreatic cancer is a change in bowel movements. People with pancreatic cancer often experience constipation or diarrhea. Constipation is a symptom that occurs when the tumor is pressing on the nerves that control the bowel movements. Diarrhea is caused by hormones released by the tumor that affect the way the body digests food. These changes in bowel movements can be a sign of pancreatic cancer, especially when they are accompanied by other symptoms such as abdominal pain, nausea, or vomiting. For abdominal pain. Abdominal pain is one of the most common symptoms of pancreatic cancer. The pain is often described as a dull, aching pain that occurs in the upper abdomen. It can be worse when you eat and may radiate to the back. The pain is caused by the tumor pressing on the nerves in the abdomen. The pain can also be caused by inflammation of the pancreas, or by the release of substances from the tumor that irritate the lining of the stomach and intestines. 3. Loss of appetite. Loss of appetite is another sign of pancreatic cancer. This is because the tumor releases substances that cause inflammation in the digestive tract. This makes it difficult for the body to absorb nutrients, which can lead to malnutrition and weight loss. A loss of appetite is often accompanied by nausea and vomiting, which are also common symptoms of pancreatic cancer. 2. Gallstones. Gallstones are another early sign of pancreatic cancer. These are small, hard deposits that form in the gallbladder or in the bile ducts. They can cause severe pain when they block the flow of bile. Bile is a substance that helps to digest fats. When the flow of bile is blocked, it can cause a backup of digestive juices in the pancreas, which leads to inflammation of the pancreas. This condition is known as acute pancreatitis. While acute pancreatitis is not cancer, it is often the first sign that there is a problem with the pancreas. So if you experience severe pain in the upper abdomen, and you know that you do and have gallstones, it could be a sign of pancreatic cancer. 1. A lump in the abdomen. One of the most obvious signs of pancreatic cancer is a lump in the abdomen. This is because the tumor can be felt as a mass in the upper abdomen. However, this only occurs in about 20% of cases and is often not detected until the cancer has spread to other parts of the body. If you feel a lump in your abdomen, it is important to see your doctor right away. It could be a sign of something serious. There are many risk factors that can increase your chances of developing pancreatic cancer. These include smoking, heavy alcohol use, obesity, diabetes, chronic pancreatitis, and a family history of pancreatic cancer. If you have any of these risk factors, it is important to see your doctor regularly and get screened for pancreatic cancer. Early detection is key to successful treatment. Although pancreatic cancer is a very serious disease, there are things you can do to reduce your risk of developing it. First, avoid smoking and limit your alcohol intake. Obesity is another risk factor for pancreatic cancer, so maintaining a healthy weight is important. You can also reduce your risk by eating a healthy diet full of fruits, vegetables, and whole grains. Exercise regularly to maintain good health and reduce stress. Finally, get regular checkups so that any potential problems can be identified and treated early. Early detection is critical for successful treatment of pancreatic cancer. Fortunately, there is no screening test that is recommended for people who do not have symptoms of pancreatic cancer. However, if you have any of the risk factors mentioned earlier, talk to your doctor about whether you should be screened for pancreatic cancer. There are several tests that can be used to diagnose pancreatic cancer, including a physical exam, blood tests, imaging tests, and endoscopic retrograde cholangiopancreatitis. Pancreatic cancer is a disease that occurs in the cells of the pancreas. The pancreas is an organ that produces enzymes to help digest food and regulates blood sugar levels. When the cells of the pancreas begin to multiply rapidly and uncontrollably, pancreatic cancer occurs. Pancreatic cancer is a very serious disease that can be difficult to treat. The 5-year survival rate for people with pancreatic cancer is only 3 to 5%. However, if the cancer is detected early, there is a chance that it can be treated successfully. There are many different types of pancreatic cancer, but they all start in the cells of the pancreas. The most common type of pancreatic cancer is adenocarcinoma. This type of cancer starts in the cells that line the ducts of the pancreas. Pancreatic cancer is often difficult to detect in its early stages because it does not cause symptoms. However, as the cancer grows, it can cause symptoms such as abdominal pain, weight loss, and jaundice. There is no cure for pancreatic cancer, but there are treatments that can help relieve symptoms and prolong survival. Treatment options include surgery, chemotherapy, and radiation therapy. Pancreatic cancer is a rare disease, but it is one of the leading causes of cancer death. If you are concerned that you may have pancreatic cancer, see your doctor. Early detection and treatment can improve your chances of survival. The main reason pancreatic cancer is so deadly is because it is often not detected until it has spread to other parts of the body. By the time it is diagnosed, it is often too late to do anything about it. There is no screening test for pancreatic cancer, so most people are not aware that they are at risk for the disease. When pancreatic cancer does spread, it most commonly spreads to the liver and the lungs. As we said, pancreatic cancer is a very serious disease, but you can reduce your risk of developing it by making healthy lifestyle choices. Avoid smoking and excess alcohol consumption, maintain a healthy weight, eat a balanced diet, and exercise regularly. Get regular checkups so that any potential problems can be identified and treated early. Do you not be afraid to talk to your doctor about your risk for pancreatic cancer and what you can do to reduce it? With a little bit of knowledge and care, you can keep yourself safe from this potentially deadly disease. We hope you enjoyed our video on 7 early signs of pancreatic cancer. If you did, please hit the like button and share it with your friends. Don't forget to subscribe so you never miss out on our latest videos. Thanks for watching. We'll see you next time.